retroactive to October the 1st, and I'm confident she will be successful in that regard. So I'm confident that help is on the way, leaving aside what the province might do, and I will continue to fight for that help until it is in place and in the hands of those who need it the most. We need to take this pause now to slam the brakes on the spread of COVID-19 in areas where we know it is active in our city of Toronto. If we follow the public health advice, if we follow all of it now, if all of us follow it now, we can protect ourselves, we can protect our loved ones, and we can protect the overall economy from much worse and longer lasting damage that could come later if we don't act. We should be doing all of this, including changes to our personal behavior, for our kids, for our parents and grandparents, for the frail elderly. I know that it's hard. This is not a decision we make quickly or easily because we know that it will have real consequences for real people and real businesses. But nonetheless, we conclude that it is the right thing to do, or we would not have asked that it be done and taken the steps we've taken on our own. I know how much people out there and businesses have sacrificed and how frustrating it can be to be asked to do even more or to do something again. But we cannot move ahead while the health and safety of our city is at risk. And on the matter of the economy in particular, a healthy economy requires healthy people. These sacrifices are time limited, and they will not last, at least as far as I'm concerned, a moment longer than is needed to protect public health. We will seek to reverse these actions as soon as we can safely do so, so that we can continue moving forward. And I would now like to ask Dr. Davila to offer her remarks for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of today, I am reporting 311 new COVID-19 infections. The new count brings our total COVID-19 cases to 20,180. A total of 16,672 people have recovered from the virus. With regard to today's numbers, certain indicators have increased as a result of quality assurance procedures. Changes were made to a portion of the new case counts, deaths, hospitalizations, ICU admissions, and intubations as a result. Specific numbers that can be attributed to quality assurance work will be noted each day as they are added on our website. When completed over the next several days, the update will add total amounts of 81 cases, 94 deaths, 35 hospitalizations, 10 ICU admissions, and 10 intubations. This information relates to cases from the spring and is not indicative of recent trends. Today, the province took action to implement a number of new requirements aimed at limiting the spread of COVID-19. Many of the actions announced by the province are the result of its willingness to listen, its understanding of regional differences, and its collaboration, particularly with Mayor Tory and Councillor Cressy, Chair of the Board of Health, who have been tireless in their efforts on behalf of Toronto. As your medical officer of health, I am in agreement with the province's course of action. It has my full support. However, I am convinced there is more that must be done to protect Toronto against the dangerous extent of COVID-19 resurgence. Let me provide to you the facts that led to my conclusions and to make this request of the province. First, let's look at the total cases month by month since March, when the pandemic really took root in Toronto. To the left of the graph, you see winter and spring, when we went through the first wave. You do not need me to remind you of the anxiety, the uncertainty, and the fear that lived alongside us throughout that time. But we came through it. And as we look across the graph, we see the results of our willpower and our determination. The numbers fell, and consistent with a decreased risk of infection, Toronto began a cautious, considered reopening throughout the summer. As we told you, with reopening, increased infections were inevitable. You see that gathering speed in the late summer and asserting itself significantly in September. In mid-August and into early September, the virus had encircled our whole city and occupied a majority of the center. In September, it strengthens and spreads again. The entire city is affected. The areas of dark blue shading suggest infections are taking root and intensifying along the lakeshore. Here are some measures of the current state of COVID-19 in Toronto. Our latest data show that there are 106 active outbreaks, including those in the community, in congregate settings, schools, childcare, workplaces, and long-term care homes. In the last 3 weeks, we have seen long-term care outbreaks increase from 2 to 9. Between September 20 and 26, there were 45 active community outbreaks. Of these outbreaks, about 18 or 44% were in restaurants, bars, and entertainment venues. There are 130 people under active investigation associated with local schools. Finally, let's look at the case counts for Toronto over the month of September. The picture is clear. Infections have risen dramatically and consistently. Since March, at Toronto Public Health, we've scaled up our case and contact management team to become the largest in the country. We have almost 700 people dedicated to case and contact management. Last spring, we developed and rolled out our own Toronto-specific case and contact data management system to support and speed the case and contact process. We also partnered with Toronto hospitals to improve the speed and effectiveness of our case and contact management. As part of the usual course of outbreak management, when cases reach a high level, public health must make a strategic shift and temporarily reprioritize case and contact management to focus on the highest risk scenarios. We're implementing this prioritization now. This is a temporary measure in response to very high case counts. The reason I am asking the province to undertake additional public health measures is to drive overall case counts down. When this happens, we will return to previous case and contact management strategies. We measure the infection rates using a 7-day moving average. On September the 1st, we averaged 40 new cases each day. On September 29th, the number was 236. These numbers won't reverse on their own. They won't reverse themselves. They will only increase without action. This is the threat we face. And this is why I am asking the province for support to do more. Quick action is needed now. I want to be clear about what it is that I propose and what I don't. What I propose is this. For restaurants and bars, I request the suspension of indoor service for a period of 4 weeks. 4 weeks represents an interruption of 2 incubation periods for the virus. These venues would still be able to continue outdoor, takeout, pickup, and delivery services. For athletic facilities, I request the suspension of indoor group fitness classes and indoor group recreation and team sports. The nature of these activities creates a real risk of virus spread, and we have seen exactly that in our community. Again, I propose this suspension for a pilot period of 4 weeks. For large venues like banquet halls, I propose a requirement that they submit a plan to Toronto Public Health, demonstrating how they will comply with public health measures, such as capacity limits, seating to assure physical distance, and the method for collection of contact information to facilitate the ability to reach those affected by an outbreak. Finally, I'm also recommending, as much as possible, that individuals only consider leaving their homes for essential activities, such as work, education, and fitness, to name just a few. What I don't want is a return to a lockdown like we saw last spring. I do not believe that is necessary. My proposals are meant to prevent the conditions that would force a large-scale lockdown. The Mayor and the Chair of the Board of Health and I will advocate relentlessly for support from the senior levels of government to sustain the sectors and the people affected by these proposed measures. The further steps I propose build logically on those announced by the province and provide for a made-in-Toronto solution for the distinct needs of our city. Without quick action to implement further public health measures, there is an acute risk that the virus will continue to spread widely, which means spread more and further and eventually faster, stressing the healthcare system and further straining Toronto's economy. We have seen what happens when the virus gains the upper hand. Spain has just ordered a partial lockdown of Madrid. And on the last day of September, the UK reported more than 7,100 new infections for the day and 71 deaths. The government's chief scientific advisor said the country didn't have the virus under control. The specific steps I've outlined would further protect Toronto for a specific period of time. These steps support many of the things we're enjoying again and the things that we need. Access to retail and shopping, physical activity, park use, and most importantly, the return to school, which is so important in so many ways. But keeping schools open requires that we do everything we can to reduce spread in the community. While I do have some authority under the Health Protection and Promotion Act, I have received legal counsel that it would be unprecedented for a medical officer of health to enact such broad changes, and that such action likely exceeds my authority and may render me personally liable. So in that respect, my ask of the province is simple. I ask the province to act, to implement the measures I have outlined for Toronto, either under its own authority or by amending the regulations governing my authority as Medical Officer of Health. It's my duty to act, to break the chain of transmission, the dangerous chain of transmission. Today, the surging infection rate proves that we are at a critical point in the pandemic. We must act to make it a turning point for the better. So that concludes my remarks, and we are ready to take questions.
Thank you, Mayor Tory and Dr. Davila. Thank you for joining us today. We will now open the floor to questions. As a reminder, it's one question, one follow-up. On the line, we also have Chief Matthew Pegg, Janie Romoff, General Manager of Parks, Forestry, and Recreation, Marianne Bedard, General Manager of Shelter Support, Housing, and Administration, Barbara Gray, General Manager of Transportation Services, and Jody Callahan from Transportation Services, Carlton Grant from MLS, Paul Raftis from Senior Services and Long-Term Care. First up, we have Austin Delaney from CTV. Go ahead, Austin.
Thank you. My question is for Dr. Davila. Yesterday, the province revised the guidelines for schools, making them somewhat less restrictive. Good idea, bad idea? What are your thoughts?
So Austin, I just want to make sure I understand the question. The guidelines in respect of schools?
Yes, schools that if you have runny nose, et cetera, what you have to do.
Okay, I just wanted to make sure you're talking about the guidelines in respect of symptoms.
Yes.
So a very good question, Austin. So here's the thing. We are still learning a lot about this virus, right? We are a new virus and still understanding what it is to open schools safely as we experience resurgences of activity in our city. And I expect that we're going to see changes over time. We've seen changes in other aspects of the response. And we are still trying to understand, I think all of us around the world, what are reliable symptoms to look at in terms of children. So certainly I am supportive of the fact that we should constantly be looking at our data, trying to understand what the circumstances are, what are the appropriate symptoms to look for in children, and adjust our decisions and adjust our guidelines and procedures in accordance with that. But fundamentally, I think what's most important in respect of schools is what we are talking about today, which is the need to implement measures so as to reduce community spread. It is in reducing community spread that we will make the conditions that are most safe for our schools to continue to operate and for our children to get the benefit of being in school.
So as a follow-up, doctor, do you support the less restrictive measures?
So, Austin, I think that we are still trying to understand what makes the most sense. I'm cautiously watching and observing. I have not had a great deal of opportunity to delve deeply into our particular data in Toronto, what we see with our children. And you can be sure that we are going to continue that collaboration with the province, telling them what we are seeing symptomatically or in terms of symptoms in our kids at school, so that the guidelines can be adjusted as need be in concert with what we're actually witnessing on the ground.
Next up, we have Jennifer Pagliaro from The Star. Go ahead, Jennifer.
Good afternoon. Dr. Davila, I'm trying to understand the context for the letter today and the advice that you were given about not having the appropriate legal authority. You say you have some legal authority, and legal experts I've spoke to say you have sweeping powers under the Act. And so I'm trying to understand how it is that you are not able to impose further restrictions or that council could not make those recommendations as they did earlier this week with some of the measures we saw for bars and restaurants.
Yeah, so I appreciate that question, Jennifer. And, while I am not a legal professional, there is one here in the room. And my understanding is that you will often get different opinions from different lawyers. This is not particularly new or different. I can say that, look, we looked at every possible avenue. We looked at every imaginable way so that we can take the measures and take the steps. My job is to protect the health of the city. I take that job very seriously. So you can be sure that I explored every potential avenue. If I had the power to do this, I would have done it. And it's just this simple, right? I'm asking the province to do it or to give me the power to do it. And if they give me that power, I will absolutely take the necessary measures to do what needs to be done to protect the health of this city.
Yeah, I just comment on that as well before Jennifer may have her supplementary. We have spent hours of time this week, and we spent hours of time in many preceding weeks during the pandemic examining this question, because of course there have been a variety of arguments, and Dr. DeVille is right. You can have as many opinions as you will have lawyers. But we have our lawyers, we rely on them. They provided steady, sound advice to us throughout this and many other matters, and they have repeatedly advised us that the kind of broad order that is contemplated by our request to the province cannot with certainty be carried out by our medical officer of health without exposing ourselves to a whole bunch of consequences, including the fact that the medical officer of health herself could end up tied up in proceedings involved with a challenge to that authority at a time when she's much needed doing other things. And we've also examined, so that you know, the option of the city council and whether it has any ability to do any of these things. And we're similarly told that we did not have an ability to do anything that would necessarily stand up, and that it would be more effective given the broader reaching powers of the province in many areas, including this, and the non-appealable nature of their orders. It was better they should enact these as opposed to us, where there was serious doubt about our ability as a council and the medical officers of health's ability to do this and have it give effect and keep effect.
You know, this isn't the first time that the city appears to be in this kind of legal logjam with the province. We've seen requests made before of the province and they either not be acted on or they be acted on months from when they were first requested. For example, Mayor Tory, the letter that you sent previously. And so I'm wondering, given the severity and the risk to residents that Dr. Davila has just outlined, how we get around that, because it seems to me like the question of certainty of success in an order or a bylaw by council may not outweigh the risk to residents right now, and that shouldn't be perhaps something that the city attempts or that the medical officer of health attempts in order to protect residents over the next couple of weeks.
We're going here for certainty. We know our doctor has told us what the right prescription is to address this, and we're going for certainty by asking the province to do this, and or to ask the province to give our medical officer of health the authority to do it, so that one way or another you get done what needs to be done to keep people healthy. But I will only say to you that our discussions with the province arising out of the letter have been and continue to be constructive. I think they've taken it on board in a very serious way. They recognize the urgency of the numbers that were presented here today and that they've been seeing as well. And so I'm optimistic that, as has been the case throughout the pandemic, we will work collaboratively with them to get the right answer, which is either that they do some of these kinds of measures, something very close to this, or they give our medical officer of health the authority to do it. Either one would be fine.
Next up, we have Lauren Pelly from the CBC. Go ahead, Lauren.
Hi, Dr. Davila. I just wanted your comments on Dr. Williams' messages earlier on. He referenced your letter suggesting, they still want more data from the city and whatnot. I read your letter. You did have numbers in there. What's your take on the fact that the province has effectively, shut down your request today, and that was his response?
Well, I think that I wouldn't characterize it as a shutdown of the request. I think what we're talking about here is an ongoing conversation, and I trust one that will be done in the spirit of collaboration. I don't think there's any question that we all wish to see the best outcomes. I, of course, for the residents of the city of Toronto, and from the provincial perspective, they are concerned, I would imagine, about the residents of Toronto, but also have broader concerns as well. So very happy to continue to supply data and information to support further discussions and collaborations. But I anticipate that what we are bringing forward should be considered very carefully. It has been very carefully thought out, and will continue to have that negotiation and have discussion with the province so that they understand what circumstances we're seeing here, so that we can control community spread, keep our schools open, keep our residents safe, especially those who are most vulnerable to COVID-19.
May I just comment on that as well? Simply to say this, I didn't see Dr. Williams' comments, so therefore I can't in any way comment on what it constitutes. I will say at the political level, in all of our discussions with the Premier and with his associates and advisors, the environment has been entirely constructive and collaborative. They have been quite willing to listen and to carefully study what's in this letter and to talk about some other needs they might have for information and whatnot. And so I think far from anything that would say there's a shutdown, it has been an entirely open discussion, and we'll see where it ends up. But I would just say they've been open, and I hope they will continue to be open, because I think what we're trying to do here is the right thing for Toronto. And I recognize they have provincial responsibilities, but we have principal responsibility and only for Toronto, and our medical officers advising and the mayor what we think is best for our city.
Also for Dr. Davila, you know, when you talk about this month-long pause that you're recommending, can you just speak a bit about, you know, what this also looks like for a lot of Toronto residents who, you know, live in very small apartments, people who don't have backyards? You know, I know for a lot of people that any notion of going back to something that feels a bit like a lockdown will be very difficult. Can you talk about just, you know, the strategies and whatnot the city wants people to be using, aside from just helping, you know, have year-round patios and whatnot?
Well, I think, you know, what we're asking Toronto residents to do is to heed our advice around how best to mitigate risk of the transmission of COVID-19. And we know much more about that now than we did even just a few short months ago. So what I'm asking for the residents of Toronto is that they keep practicing what we have talked about as the 3 Ws, or those self-protection measures. And part of that is limiting those social interactions as much as possible. So it's around watching your distance, wearing your mask, washing your hands. I think to the extent that we can get residents all around the city to really be dedicated and disciplined to practicing those self-protection measures, the sooner we will be able to get beyond this, to control the spread of COVID-19 in our community, and to continue with all those necessary services and aspects of life that mean so much to us, and particularly at this time. I have to say that I'm very concerned about doing all that we can to reduce community spread of COVID-19 so that our schools can continue to run safely. So that's what I'm asking of the residents of Toronto.
Thank you. Next up, we have Francine from the Star. Go ahead, Francine.
Oh, hi. My question is for Dr. Davila. Medical professionals have known for months that there could be a resurgence in the fall, and here we are at the beginning, at least, of a resurgence. And what's being done feels a bit reactive, and I'm wondering, is there a plan? What's the plan?
So there is indeed a plan, and this is in fact, you know, the resurgence and taking these kinds of actions in response to what we're seeing on the ground is exactly what's done within the context of communicable disease prevention and control. It's what's done in the context of outbreaks. We need to put prevention measures as much as possible into place, and we have exhorted our residents to practice self-protection measures. We've continued to have a number of measures in place, but as this virus is quite transmissible, it's clear that further actions are necessary. So we're asking for the powers to implement the actions necessary to control the spread. And I think you will recall that we have been speaking to the public in Toronto, suggesting that these are the kinds of activities that are going to need to continue. We are going to need to continue to engage in self-protection measures. We are going to need to ask government to do their part so that the ability for individuals to engage in those self-protection measures is facilitated to the greatest extent possible. And we will need to continue to do this together until such time as we have more effective treatments and effective vaccines against COVID-19. This is a common refrain you've heard us say throughout the past many weeks and months, and I think you will continue to hear us say that until the time of effective treatments and effective vaccine is upon us.
And a follow-up question. I think it's obviously harder for people now to to do the things that need to be done to keep the transmission under control, it's harder to think about staying indoors and not being in touch with other people. I mean, how do you overcome that?
Well, I think we have demonstrated that we have that willpower, we have that strength, and we have the capacity as a community. It's the same refrain you've heard us say many times. I think that to the extent that we can all really dedicate ourselves and be extremely disciplined around self-protection measures, the more we're able to do that, the sooner we will be able to, manage the measures and allow for more movement and activity in the city. I think this is a very simple, a piece of advice to those residents in the city. And I realize that it is difficult to do. I realize that people are tired. And I realize that it is actually hard to make these changes to our lives. But to the extent that we want to be able to get back to more of the activities that we enjoy, that's why I'm asking people to continue to dedicate themselves to those self-protection measures, and that they can count on us, here, protecting their health, to do the very, very best we can to support them in conducting those self-protection measures as much as possible.
Thanks, Francie. Next up, we have Lucas Myers from News Talk 1010. Go ahead, Lucas.
Thanks, Levin. For Dr. Davila, we've been kind of hearing of kind of different communication issues when it comes to schools. For example, we heard from a parent today where there was a positive case in her daughter's school and that it was in a grade 5 class, but they didn't say which one it was. And so according to this parent, all grade 5 students went to the school as opposed to wherever this one in this cohort happens. And that there's, word between the TDSB and Toronto Public Health. I'm just curious, have you been hearing a lot of reports of these types of communication issues, these lags, if you will, between the board and Toronto Public Health? Can you speak to if we know that, potentially infected kids where we could prevent them are being allowed back in school? Because isn't it automatic that once there is a confirmed case that cohort has to then go home?
So I can't speak to the specifics of that situation, but I can say that because, this is a new virus to us, and this is the first time, I would say, for us as a local public health department, for our provincial system in respect of laboratory testing, and for our school boards and the local schools themselves to actually try to operate within this environment where COVID-19 is in our community. And when embarking on any new kind of activity in new circumstances, I think it's reasonable to expect that there may be some challenges. But what I really want to focus on is that there is goodwill between the different partners, that we treat each other kindly and well, and that we seek to address each other with understanding so that we can get through the problems as quickly as possible and create as safe an environment as is possible for our kids. We know that with COVID-19 in our community, we had always expected that there would be cases of COVID-19 in schools. That was without question. We knew that would happen. The issue is, how best do we work together as families, parents, kids, communities, school boards, schools, local public health, all the partners trying to work together to create as safe as possible environments for our kids? I think that's what's really important here. So I would ask that we all commit ourselves towards doing that as much as possible.
And for my follow-up, just to go back a little bit to what Lauren was asking about with regards to the request to Dr. Williams, have you been given any indication, time is kind of the essence here with, new cases every day. Have you been given any indication of when you might get an answer on this?
So I think what I have been given indication of from Dr. Williams is a willingness to work together. There isn't a time, that has been provided. However, we are regularly communicating. I see a receptivity to having, our input and to hearing what we have to say. As you've heard the mayor say, there has been a strong collaboration, a very open environment, one that is characterized by receptivity. I trust that that will continue, and I trust that we will continue to work together to best protect the health not only of the residents of Toronto, but in their regard, the residents of the province of Ontario.
I want to reiterate again, they have different responsibilities than we do. They have responsibilities for the entire province, and we have probably more information at our disposal with respect to Toronto than they would. And so it does take some time often in these kinds of instances. And again, I will not speak to the medical professionals because Dr. DeVille has spoken to that, but I will just say at the political level, there is an extensive, continuous communication back and forth between the two governments, and that I have every confidence that they will process our request as quickly as possible, consider it, look at their own evidence, ask us questions, all of which they're doing now. And I know they'll consider it in a very considerate way, but there is no daylight between us in that regard at all. We're working together on this because we have the same objective in mind, which is to keep the people of Toronto and all the people of Ontario healthy, protect the healthcare system, and make sure that our way of life is not adversely affected any more than it has been by this terrible virus.
Thanks, Lucas. Next up, we have Matt Bingley from Global. Go ahead, Matt.
Hi, good afternoon. Just with respect to that question, I know you keep speaking about the spirit of collaboration, but Dr. Davila, I'm wondering, when you say that a swift response is needed to get this under control, you have passed on the data, but what is an acceptable amount of time for you to actually get a response? Is it days? Is it tomorrow? Could we just get a little bit more clarity there on what is an appropriate amount of time?
So, Matt, I think very simply put, as soon as possible, the sooner the better. I am very keen to make sure that we are implementing the measures and taking action to best protect the health of Torontonians. I will say that, look, we have had lots of conversation. You've heard the mayor comment on what's happening at the political level. It's certainly happening between ourselves here at Toronto Public Health and our public health counterparts at the province. We want to continue those conversations. We would like to move them along as quickly as possible. We've already seen quite a bit of convergence over the course of the last few days, and I look forward to further collaboration and further convergence sooner rather than later.
And that 7-day average that you showed us, that has really precipitated these actions. It ended just a day after, well, I guess on Tuesday. On Monday, you were really looking for council to implement more changes to the restaurant industry in reducing the numbers there. I'm just wondering, why have you decided to ask for these today? What is the difference between Monday and today when there were so many other days that you could have asked for these?
So, a very good question. And I can tell you this, when it comes to dealing with COVID-19, a few days makes a world of difference. And in fact, so much changes within the context of just one day. This is a very rapidly evolving situation. You've heard the mayor make comments around getting access to data and understanding the situation on the ground. It is a very complex thing to manage a communicable disease outbreak. I think we talk about terms like case and contact management. We talk about terms like the data and the numbers as if they're relatively simple concepts. They're not, and actually there's quite a bit that underpins all of that. A great deal of effort, a great deal of care, and we have a rapidly evolving situation. So when it comes to COVID-19, my experience over the past several months is that what seems like a few short days actually makes a world of difference. And from a professional perspective, it's my responsibility to make sure that we adjust and change our approach premised on the information that we see, even when that information changes at wartime speed, if I can borrow a phrase of the mayor's. And I can assure you, this virus does actually move very, very rapidly.
Thanks, Matt. Next up, we have Nicole Thompson from the Canadian Press. Go ahead, Nicole.
Hi, Hi. I wanted to take it back to schools for a second. We're hearing from the TDSB that 7,000 elementary students will be switching from in-class to online learning at the earliest opportunity, so in about 2 weeks. Does that say anything to you about how parents feel about the safety of schools in Toronto?
Well, I respect the opinions of the parents of children in Toronto, and I respect their choices. I think they should make the choices that make the most sense for their own unique circumstances, what makes sense for their children and what makes sense for their broader family. I imagine that many of them have different living circumstances. The parents themselves may have chronic disease issues. They may live with a grandparent or another elderly relative. And I think that all those aspects need to be considered in making the decisions. So that doesn't take away from the fact, though, that from a public health perspective, we completely appreciate the value of schools to our children and to their overall health. So we are doing everything we can in concert with our school board partners and with local schools and many other community stakeholders to create environments that are as safe as possible for our children. And I think it's important again to emphasize that with COVID-19 in our community, that we should expect to see COVID-19 cases in school. However, what I do think is also important is that while there are a number of cases in our schools, we have been very fortunate thus far with all the protocols in place to be able to limit outbreaks thus far. And I think that that's what's really important here, that we work together as a community, public health, schools, school boards, parents, families, etc. We all do our part to do what we can to reduce community spread and to keep our schools as safe as possible.
All right, thank you.
Okay, next up, we have Rachel Mendelson from the Star. Go ahead, Rachel.
Hi, Dr. Davila. Thank you for taking my question. I wanted to go back to the revisions to the school guidelines that were announced yesterday by the province. So we're hearing from parents and school boards who are confused, and they say they're all waiting and looking to see what Toronto Public Health is going to do, because this impacts whether their kids can go back to school, Monday, and the week after that. So I want to ask you very directly, will you change your guidelines to match the new provincial ones? And if so, when?
So Rachel, I think you ask an excellent question. Again, provincial guidance is provincial guidance. We are at limited ability to act on our own, as you've heard me say, in respect of implementing various actions. I think it's important to know, though, that we are all working hard, all trying to apply the best available evidence to create safe environments in our schools. I know that the members of my team who are a little closer to this work are in active conversation every single day with our school board partners and as well with our provincial partners. And I have no doubt that with their desire to create safe school environments, that they will come to a reasonable conclusion that makes sense for our students here in Toronto, in our local schools. And yes, we may have to adjust that, but we will always work towards creating the safest environment possible for students in Toronto.
And you mentioned that you have limited power to do this. I'm wondering, if you're considering tweaking the guidelines to reflect what you're seeing on the ground in Toronto. If you're able to do that, for example, to continue requiring testing for symptoms such as runny noses. And again, just to repeat the second part of the question I asked before, really very anxious to know when you might release your new guidance.
So Rachel, I will be very happy to talk to you offline. I can consult with the team around what we are thinking. But again, provincial guidance is provincial guidance. They do govern that which happens in public health in the province. They actually set out the standards for public health units across the province. And so I think we have to really work with what they've got there such that we can create the best environments for our students. If our local data differs or tells us that we need to do something different, we will take that course of action up with the province and let them know what it is that we're seeing so that we can make the best decisions for the residents and the students in particular of Toronto. But, I think that that's our responsibility as local public health officials. And we have every intention of working with the stakeholders and partners who are engaged in that regard.
Thanks, Rachel. Next up, we have Scott Lightfoot from CTV. Go ahead, Scott.
Thanks, Levin. Dr. Davila, just to follow up on what Matt had asked about the timeline, the suggestions you're making today, when did these become sort of top of mind? I know you mentioned that things are changing very rapidly, but what was the first point where you sort of realized this is where we need to go? And were you hoping that the province would go further in its recommendations today than it did?
So we've been working on these for the past, right over the course of this month, as we were seeing numbers start to elevate and really increase in that very consistent way over the course of the month of September. We were obviously monitoring that and thinking about how best to adjust the circumstances in our city to address what we were seeing in the data and to control COVID-19 spread. So, and these things do take time. So we've been in active conversation, certainly here at Toronto Public Health, and are eager to continue conversations with our provincial counterparts, which have been going on for the past, week plus. I mean, there's constant conversation between us and the province, but with respect to increased measures and actions, certainly over the last week or 2 weeks, it's been increasing as in accordance with what we're seeing on COVID-19 resurgence.
And just to follow up, in your letter, you mentioned that officials are sort of looking at what was done in Melbourne, Australia. Can you sort of explain what you've taken from their experience there and what maybe they've done that you're not looking at doing?
So when we look at the situation in Melbourne, what we saw was them taking very swift action in respect of COVID-19 control and it's a city about the size of Toronto, or it's comparable anyway, which is why we were particularly interested in looking at it. And as well, their experience is relatively recent. They're just a little ahead of us, and they're on, as you know, they have their winter season, as it were, was during our summer. So we actually have a fair amount of data already compiled as to what happened in Melbourne. And so they took very swift, very strict measures. And in fact, they went to a complete and total lockdown. That is not what we're advocating for here. But what we are advocating for is swifter measures in order to bring virus resurgence under better control in a more rapid fashion. And what we have seen throughout the world is that quick and more decisive measures taken early on actually mean that you can suppress the virus transmission faster and allow for more movement, more freedom, more activity after a shorter period of time, rather than waiting until cases get to a higher level and then implementing public health measures.
Thank you, Scott. Next up, we have Sean Fitzgerald from The Athletic. Go ahead, Sean.
Hi, a question for Dr. Davila. The Greater Toronto Hockey League is due to return to the ice with its teams and thousands of players starting next week. Have you reached out, or has your office reached out to them directly? And, because so many teams and players skate on city ice, would you be in a position to, directly close the arenas that are owned and controlled by the city?
So we have yet to have some conversations with those affected parties, the GTHL in particular. Certainly happy to have those conversations because we recognize that these measures that are being proposed have some significant implications for a number of residents around the city. But fundamentally, what we're talking about is doing what we can to control COVID-19 and its transmission in our city, premised on the evidence that we have and premised on our local data. And I can assure you that when we look at our local data over the course of the last several weeks, but in particular over the course of the last month, what we have seen is that those indoor exercise, fitness types of activities are giving rise to the conditions that lead or are more prone to virus transmission. And in fact, we're actually seeing that. That's why we're making this recommendation, even though we know it has significant impacts on a number of residents throughout the city.
Just for my quick follow-up, have you specifically seen, is there evidence that there has been transmission inside hockey rinks or basketball gyms?
So it recently came to my attention, just yesterday, in fact, that we are seeing exactly that kind of transmission.
Okay, that's it for today, everybody. Thank you so much. Have a great weekend.